Hi, I'm Dr. Kurt Woeller. Let me talk about rheumatoid arthritis and the potential link to gluten sensitivity. Now, gluten is a protein found in wheat. We know that individuals who have what's called celiac disease actually have an autoimmune where the immune system is reacting to the gluten protein in wheat, which can lead to an autoimmune process in the body. In fact, they know that it can lead to digestive issues, it can lead to neurological problems, can lead to joint problems. And so many people who have celiac disease have to be very, very careful in avoiding eating anything that has gluten in it. Now, when you talk about somebody who is reacting to gluten, what they're really reacting to, or at least somebody who is celiac, what they're really reacting to is what's called gliadin. Gliadin is a subfraction of gluten, and that's what their body is having a difficult time processing. Now, you can also have what's called a gluten intolerance and not have celiac disease. So essentially, the immune system for these types of individuals is reacting to the gluten protein in general, but it's not necessarily triggering an autoimmune process. It certainly can trigger inflammation, certainly can trigger pain, etc. And in these types of people, what I have found is that it can certainly exacerbate an underlying inflammatory arthritic condition of the joints. So a couple different things that we analyze for from a testing standpoint. I talked in the previous video about a food IgG analysis. You can do it off a finger prick test, or you can do it a blood test as well. And that not only looks at wheat as the whole complex of wheat, but it also looks at gluten and even subfractions it down to look at gliadin. So we're not talking necessarily a wheat allergy, which is being generated from a chemical called IgE. We're looking at a wheat sensitivity, gluten sensitivity, i.e. gluten intolerance, through this immune chemical called IgG, which can trigger an inflammatory cascade throughout the body over time. So many people with rheumatoid arthritis often feel a lot better when they remove gluten from their diet and gluten wheat grains and wheat products. They just feel a level of improvement with respect to the joint flexibility, less inflammation, etc. So it's important to have at least an understanding about gluten intolerance and its relationship to rheumatoid arthritis. And if you haven't looked at starting a gluten-free diet, I always encourage my patients to do so because it just helps so many people feel so much better. Thanks.